Hello, and thanks for tuning in to Shelby and Regine's presentation on deaf-blindness. Shelby is a first-year grad student specializing in English language learners, and Regine is a middle and elementary school French teacher in the Buffalo area. We hope that after this presentation, you will have learned more about students who are deaf-blind and are better able to serve their needs in your classroom. According to Project Ideal in Action, deaf-blindness under federal law means concomitant hearing and visual impairments, the combination of which causes such severe communication and other developmental and educational needs that they cannot be accommodated in special education programs solely for children with deafness or children with blindness. Essentially, this means that people who are deaf-blind have a combination of vision and hearing loss. Deaf-blindness can be present at birth or acquired, and it is a spectrum. So people who are deaf-blind can range from mildly hard of hearing plus mildly visually impaired to totally deaf and blind, or a combination of the severity of vision and hearing loss. According to the National Center on Deaf-Blindness, in 2017 there were an estimated 10,000 deaf-blind children. Children aged birth through 21 were considered in this count. California is home to the highest rates of childhood deaf-blindness in the United States, while white men comprise the highest overall statistics of deaf-blind in the United States. Pushed by the National Association of the Deaf, hearing impaired is no longer the correct term for those who cannot hear, as this connotes a lacking in something. In August of 2018, Governor Cuomo signed a bill striking the phrase from legislation, and deaf or hard of hearing became the correct title. The warning signs, symptoms, and behaviors that deaf-blind children may display are isolation, lack of communication, and lack of mobility. If the child isolates themselves by not playing with peers and/or remains immobile with no attempts to communicate with parents or peers, the child may need further evaluation to determine deaf-blindness. In addition, an atypical look to the eyes and ears, poor hand-eye coordination, light sensitivity, lack of reaction to noises such as parents' voice and sudden noises, and limited vocalization are also signs and symptoms of deaf-blindness. It is rare that an individual with deaf-blindness would be completely blind and completely deaf. Typically, there are limitations to both, but complete inability is rare. Again, deaf-blindness is a spectrum, so each individual's ability is different. Even the limited amount of vision and hearing that a deaf-blind person may have allows them to see sign language, recognize sounds, understand speech, and even develop speech themselves, which opens many doors and allows for greater communication. The National Center on Deaf-Blindness adds that people who are deaf-blind have a unique experience of the world. Physical contact is an essential experience for a child who is deaf-blind, because if they are totally blind and deaf, their sensorial experience of the world is solely through touch. Their experience of the world extends only as far as the fingertips they reach.
Some major causes of deaf-blindness are Down syndrome, trisomy 13, and Usher syndrome. There are both pre- and postnatal causes as well, including fetal alcohol syndrome, maternal drug abuse, AIDS, meningitis, and stroke. Deaf-blindness can coexist with other disability and heart and brain problems that are commonly accompanied by deaf-blindness. Usher syndrome is the genetic disease that affects nearly 50% of the population who are deafblind. It leads people who are hearing, hard of hearing, and deaf to lose their vision later in life via retinitis pigmentosa. Birth trauma, optic nerve atrophy, cataracts, glaucoma, diabetic retinopathy, accidents, and illnesses are other causes of deafblindness. Communication is the greatest challenge for people who are deafblind. Through the use of interpreters, books, and alternative technology, communication is possible. Communication is not only verbal. Communication with people who are deafblind can include body language, gestures, and sign words. In addition to the use of body language and gestures as a mean of communication, deafblind people also use hearing modifications such as hearing aids, visual modifications such as large print, and tactile modifications such as sign language. There are two different kinds of signing: tactile signing, which includes American Sign Language, and two hands manual, which is also known as the deafblind alphabet. In addition to sign language, deafblind students may also learn how to read and write in Braille. There are even devices that allow for reading and writing Braille face-to-face in real time. In our ever-inclusive society, we have thankfully developed ways to inclusively communicate with each other, including those who are blind. Those who are deafblind may likely have difficulty navigating physical spaces. It is important to teach children as soon as possible to pay attention to their surroundings, possibly starting as young as recognizing a crib. Positive reinforcement, including a tactile reward system, can inspire children to continue to explore their space and motivate continued movement. A child who's deafblind may be supported by numerous professionals in order to develop skills and learn how to communicate with and navigate the world. These professionals may include, but are not limited to, teachers, physical and occupational therapists, vision teachers, health professionals, and orientation and mobility specialists. This professional may also be included in the development of IEP plans for deafblind children. There are many things that teachers can do to accommodate for deafblind students. Some examples are arranging seating in a way that promotes inclusive learning for the students, keeping pathways and work surfaces clear, announcing when a teacher arrives and leaves the room, and including tactile learning in lesson plans. Due to a deafblind student's potentially severe disabilities, IEP teams need to create a highly individualized plan for students with access to different specialists that address each student's unique abilities. Deafblindness can mislead teachers into over or underestimating the student's abilities, therefore frequent assessment is crucial. We hope that you're able to walk away with new knowledge of the deafblind community that you're able to implement in your own teaching when working with students with disabilities. Support, resources, and inclusivity will allow students who are deafblind to receive the same level of education as students without disabilities in order to learn the skills necessary for living productive life.